Good morning, Sabbath School. Good morning, good morning. Happy Sabbath. We're going to segue into the health focus. Our health focus today is what are we doing? Looking at resources, looking at health resources in our communities that can support us. Today's our fourth Sabbath. We generally do this on our fourth Sabbath where we do blood pressure checks, we do body fat analysis, and for those of you, before I get into that, let me introduce myself. My name is Dr. Dale Grace. I'm a credentialed school nurse, nurse practitioner. I've done research and published 2 books. I'm currently working in the school industry, and we won't talk school health today. It'll be a next month's topic. But today we're looking at resources that are available to you. Last month, what did we do? Anybody here remember what we did last month? Nobody? Nobody remembered what we did last month? I don't either. Yeah, we did have the same setup we have outside, which is blood pressure checks, body fat analysis, and we had a speaker that came in for a few. Actually, it was Dr. Batiste who discussed the concept of marriages and how to preserve your marriage, how to be a better eater, less stress in your life. So in moving forward, now we're looking at the resources in your community. This program happens to be number 15 of ones that we started last year, and this year we're going to continue as long as the Lord's willing. Okay? So today's resources is going to be presented by IEHP providers who have a table on the outside. You must know that. If there are resources you need to either enroll into insurance, it's available out there. You can get your blood pressure checked and take it to your provider. Let them know where you are today. I think it's made a difference. I'm going to ask the question, who's out there that had their blood pressure checked in the last year and it made a difference? I know in my family it does. My husband started doing his blood pressure every time you come in here and open up. So it's a blessing. And you can take those same numbers on the printout and take it to your provider. It'll tell you whether or not you're within range, out of range, or at the high level, which says this is a 911 call or urgent care call. So those are things you need to keep in mind. Your breakfast out there is free. It's a vegan breakfast, healthy way of eating, and looking at the way you perceive yourself as far as food. And that food out there, it amazes me. The kids love the oatmeal. That's something I'm not used to seeing. And working in the school district, they don't even eat. You have to waltz them back from the health office. You need to eat before you start your day. Because you go all night, 10 to 12 hours, and you have to break the fast in the morning. And that's the only way you do that, on breakfast. What a concept, huh? What a concept, break the fast. And so they go in, how do you feel? I feel much better. Good, you can survive today, okay? And that's the same for us. We think we can run on air. It doesn't work. So for those of you that got an invitation to this program, you should have a flyer that looks like this. I got to watch my time because we're limited on how much we can spend up here. You should have a flyer that looks like this. And on the flyer itself, it gives you information about the CDC. If you touch the CDC, it'll tell you things that you need to worry about right now in your backyard, mosquitoes. See if it'll come up. If it doesn't, it'll tell you about vaccines, where you can go to get healthier resources. It's not coming up. I don't think we have enough on the screen to do that. No. But you can tap that little button, and it'll say cdc.gov. That's the one you need to open up. CDC. If you don't remember it from touching it on your phone, cdc.gov. It'll open you up and let you know what's happening in your community today, in your state, in California, in your city, in your county. And you need to be aware of that. COVID, you know that. COVID is now increasing, so we have to be aware of that, how we expose ourselves, correct? Anybody out there in agreement with that? Yes. So you have to watch your environment, who you're around, how much time you dwell around that person that's coughing. You got to know that a cough travels 70 miles per hour. Those droplets float. They hit the vents. They go into other rooms. So in the school setting, That's what we have to worry about. I have 5 sites in a school setting with 41,000 kids. We have to keep them healthy. It's the same in your church. So those droplets move. So if you're sick, don't come to church. If you're sick, take care of yourself. Get yourself back in shape, and then come to church. Okay, so just knowing that on the COVID vaccine, on COVID, if you're a vaccine, if you took the vaccine in the past, there's another article by the CDC that says the impact of COVID is affecting our hearts. And that's interesting. So if you think you have a cardiac history, or if you're experiencing lightheadedness and fluttering of the heart, or your rapid heart rate, or you just feel unusual, what do you need to do? Anybody? You need to see your provider. You have to see your provider. That's what makes a difference. It says heart disease is likely to remain the #1 killer in the U.S. indefinitely due to long-term COVID impacts, so you need to know that, okay? And that's straight from the CDC. And the last page, when it comes to health, as of to date, you have received, this is number 15 program presented, and your last 14 programs been provided by a PhD or a doctor or somebody with a license. What we give you is information that's based on research. It goes through the church, I approve them, it goes through the church, it comes back, we create a flyer, and we make sure you get that information and you're safe. Because according to the medical board, they're tightening up on who calls themselves a provider. The mission of the Medical Board of California is to protect healthcare consumers and prevent harm through proper licensing. So you want your directive to come from somebody that's licensed, whether or not it's your provider or your referral to another provider for whatever your health issues are. So you have to keep that in mind. Unlicensed people, they can only direct you from their own experience. And those experiences are valid, but you need to go to your provider who's based on research. There are laws that protect you through research. So they compare data on one side of the country to the other, and the data is usually like a meta-analysis, thousands and thousands of providers put into a database and said, this is what we see. They come up with a standard of care that's provided to you based on research. So you have to know that. They just don't make it up. Now, from lay person, unlicensed person, it could be their experience. And you can say, thank you for that experience. I learned a lot, but I'm gonna go see my provider. Thank you, because it makes a difference. And we're seemingly seeing a lot of people experiencing medical health issues more recently. I'm not sure how we can address that, except for when I look at the research, it says the #1 killer in the US next to heart disease and cancer, what would you think it is? Anybody? Medical errors. Medical errors could be omission, something that a provider didn't tell you or did tell you and didn't support it adequately or treated you appropriately. If you went to urgent care, needed care, and he's not managing you well. Most of you guys in here, except for about 7%, most of you in here have insurance. The numbers were much higher quite a few months earlier, 14%. We're now down to 7% across the nation that does not have insurance. You have to know that. So it's improving. Continue to do that. In your insurance, you have a case manager. Gotta watch the clock. I got a minute on this. You have a case manager. You're assigned to a case manager that can direct your care. You want a specialist? Ask for your case manager. It's on the back of your card. It's your customer service. It's your right. And they can help you find your specialty, especially if they give you a diagnosis. You're assigned a case manager outside with your insurance, outside meaning in your home, and when you get into the hospital. So you're entitled to plan your care before you go home. Your caretaker matters. So just keeping that in mind. So with that said, it's 11:10. These guys need about 10 minutes to present their project on the community resources available to you. This is Derek, I'm sorry. See, I knew I'd blow it. And he's here, Derek Swanier, okay? And we are so happy to have him. He has a table outside if you never need to reach him after his presentation. Awesome. Then we have Ivory Summers, who's here to support him as well from IEHP. So just know you have IEHP outside as a resource just for you. So I'm going to turn it over to Derek so he can tell you what community resources we have available.
Can everyone hear me okay? All right, good morning, and thank you for Mount Rubidoux for having us, and also Dr. Grace for bringing us today. So I'm a CHW, as long as Ivory as well, for IEHP, and what a CHW is a community healthcare worker. So some of the issues that Dr. Grace touched on as far as individuals having insurance but not receiving the proper care. Equality is something that everyone should have, but equity is what we preach at IHP for each individual to have, because not everyone needs the same type of health care coverage. Some individuals need specifics and others kind of just need like a basic care. So for IHP as CHWs, what we do is we advocate for members to understand the information that their doctor is giving them. I also understand the health education that's being provided to you about your medication, understanding your medication, understanding the release forms that the doctor gives you. If you need an individual to come out to your appointment with you to be an advocate, to make sure that you understand the information that the doctor's given you, along with home visits. If you have questions about your medication, questions about changing your primary care doctor, or getting information on how do you reach out to a specialist, is what we do. Upon doing the home visits, we also go over things like high blood pressure, diabetes, hypertension, making sure individuals know how to read their A1C. And myself, I'm at the Riverside Wellness Center, which is right across the street from the Tyler Mall. And we have a wellness center there where we have health education classes that touches over everything about diabetes, healthy eating, hypertension, high blood pressure. There's also health education classes about my healthy eating, as well as fitness classes as well too. If you're an IEHP member or a non-IEHP member, all classes are available to the community, and they're free for everyone. There's no charge at all. If you are an IEHP member, then you are able to get a ride with Call the Car, which is a free resource that you have as an IEHP member as well.
Question.
Yes.
You mentioned, I was looking at your literature, and it mentioned about paternal wellness as well as maternal wellness.
Yes.
Can you talk about that a little bit?
So as far as maternal wellness, we have a lot of different outside vendors that we work with, organization like Pamper My Baby, where new moms and dads can come in for resources and assistance on how to become a new parent. If you need help with diapers, baby clothes, car seats, just a bunch of resources and information. For moms, there's also, in the table outside, there's guaranteed programs for moms that can get paid as well. For dads, we have, with SBX, we have a cohort at our wellness center every Friday as well, so dads can come out.
What is the SD? What is that?
SBX is Sigma's. They created a cohort course for dads. This has been in works now for a total of about 8 years, and they also now have it at our wellness center.
Awesome.
Yes. As far as for moms and dads as well, we also work very closely with Black Infant Health, and we do different workshops with Black and Infant Health at our wellness center. And again, this is something that's open to the entire public as well too. Majority things of what we help with is health education, informal counseling, provide referrals and direct services, navigate and assuring access care, advocating for individuals and communities, conduct social determinant of health appraisals. And that's what we mainly do, to check in with you to see what type of assistance you need and how we can better help you understand that information and find those resources for you. One thing that is very important to me is food scarcity. That seems like something that all of us deal with. And through IHP, we have multiple locations, and there's a calendar out in the back on the table where we have different food distributions. There's small food banks in the area as well, but the food distributions, they give out fresh produce, and this is different locations twice a month, but they provide everything from different salads, bell peppers, so on and so on, just a bunch of fresh produce, because some of the smaller food banks will actually give you a box of dry food. So this is something that's available to all members, and I love to share it with everyone because we all should be able to eat.
So my other question to you is, we have multiple black churches. We have over 17 churches in the Southeastern California Conference, and most of us do need that resource. How can they get connected?
You can get connected. There's a flyer in the back. The entity is called Be in a Star. They're the ones that put together the food distribution with the different locations. And my goal is hopefully to make this location to be another food distribution location. I know there's already something going on, but hopefully we can add to that and, you know, provide for the congregation and members of this area. Again, if you have any questions, my information is in the back, as long as with Ivory as well. A lot of people think like, I don't need a community healthcare worker, I'm okay, but there's always information that either we don't understand or we would like a little additional help, or sometimes it's just someone going to a visit with us, and that's what we do. Here's some of the social determinants of health that you see on the screen. I talked about food. There's hunger, access to healthy options. Education is definitely a big one. So at the Wellness Center, we have a lot of different classes for literacy, early child education, and also higher education when it comes to learning how to manage your A1C and other things, depending on what affects you. For neighborhood, we also provide housing. Now, IHP does not provide housing, but there's third-party individuals that we connect with to, depending on your situation, whether it be a single mom or a single dad or a family in general, different locations take different housing navigation, and so we get you to those correct vendors. Transportation I spoke about earlier, because we have something called Call the Car. If you're an IHP member, that resource is available to you for free. You can get a ride to any wellness center, any doctor visit, any pharmacy visit, and also to dentist and eye doctor as well too. And you can get a ride to the food distribution as well too. If you want to go by, stop by and see how it is for the first time, you can get a ride for free. And all you have to do is just sign up 48 hours before the appointment is.
Now, this is a relatively new program, correct?
Yes.
Miss Ivory, can I get you to talk about that just a little bit more? I'm going to just give her that opportunity to make IEHP shine.
Yeah.
Go ahead.
Thank you. Good morning. My name is Ivory Summers. I'm here to assist Derek, but I too am a CHW, and what we're doing in the community is we're shaking it up, simply. We are coming to our community and we're bringing you resources to help you in so many ways. Most of us all have a need. There's never a time as people that we don't have a need, or someone we know within our homes need something. Well, we're here to fulfill that. We're there to kind of fill in that gap and give you a resource so that you can get anything that you need taken care of. So we have hunger in our community. I do a lot of events like Derek, and Derek works at our center, but I'm literally out in the streets, if you will. And what happens is I meet people every day that have a need for food. I meet people every day who have a need for Black infant care. I meet a father every day who needs a job resource. I meet a mother who is maybe battling with, teenage mental illness. There are so many things and so many resources that we can give you. And how we give you those is based on, us sitting down with you, having a private conversation, and then giving you resources. We're all over. You should be able to see us everywhere. But the most important place we are right now, I think, on a weekly basis, every day of the week, there is a food distribution. There is a food distribution every single day, and I'm not seeing anyone that looks like me at them.
So we're working towards getting, on the second Tuesday, for those of you that don't know, we do a community outreach as well. How many of you guys know that, other than me? That's right. There's a community outreach where you can come in for food, so we can always add to that. And then on Sabbath, we have food distribution here as well.
Yeah.
So we'll continue to support it as long as we can.
Well, we'll definitely, and I know Derek is going to work hard on that. I will assist him. I will always be in the background because this is Derek's assignment, if you will. God gives us all assignments. This is his. And I'm here just to support. But to let you guys know, food distribution is very important. I'm going to tell you why. Not only does it nourish your body, but it helps you with the bottom line and cost. A lot of people are going through a lot of cost problems right now, including myself. We have more of our children moving in with us. We have family members who are going through so much. And the food costs, the electricity costs, the utility costs, the car costs, everything has gone up. So as a CHW, I'm here to give you resources that can help you with food. I can help you with utility assistance. I'm not going to give you the money, but I'm going to give you a resource that will help you with those bills and so forth. I even have resources when there is money to help those who need to pay their rent, those who need to get a deposit. I have low-income housing resources for those who need it. We have so much to give to our community. We'd love it if you would spread the word. If you need it, please come and see us. If you know someone who needs it, we'd ask that you please just be open to the idea of getting help. There is nothing wrong. Everyone else is getting it but our community. And that's why Derek is here. That's why I am here. We're here to let you know that there's somebody here that's got your back. Okay? All right. Thank you so much.
One of the things I notice, even with my own health insurance, I have Blue Cross. I got a call the other day saying, I'm here for you as your care manager. It's like, why do I have you calling me? And she's asking me all the same questions she's asking. She's letting you know about. Do you need an attorney? Do you need somebody to come out and help you in the home? It's like, why am I getting this? I'm not that old yet. But just knowing that resource is available through your insurance, take those phone calls and listen to them. Give them the time of day. They're here for you. And it doesn't cost you any more than your monthly cost. So if your monthly cost is around $800 a month, think again. Use those resources. We have about a minute to close. Any questions? If you do have questions, we'll be out in the lobby. These guys will also be out in the lobby. Quick question? No question? Just no blood pressures are being taken. If there's food, breakfast area, please consume it. It has to go. Question? Question? No question? Oh, Adrian, this is my son. You know he can ask me this question at home, but that's okay. Go ahead.
You said at your wellness center, do you have other resources that people can go to get mental health, like support groups that say, hey, look, I'm just in the community struggling with so-and-so, that the best step you can do is to reach out to your wellness center and go get help. Like, hey, we have a support group here. There's places you can talk about communication.
Or your provider, Adrian.
Or your provider through IEHP. Yeah. What are some support groups that you have there?
We have a couple of support groups at the Wellness Center. In addition to meeting with a CHW like myself one-on-one, we will be able to give you an assessment to see what type of behavioral needs an individual may need, whether it's therapy or psychiatrists, et cetera. And there's also other workshops and programs that IHP puts together for behavioral services as well. And that's also open for adults and children under the age of 18 as well.
Okay. Well, thank you for your time and attendance. We do appreciate you. Provide feedback and let us know how we're doing. I'm not sure where I can tell you to provide feedback, but for those of you that received my text, let me know what else we can talk about. We want to hear from you. And if not, let anyone know. Let your pastor know we need to hear more on heart disease, more on hypertension, more on resources. Again, thank you, Mount Rubidoux. Thank you, members. And this is it for us. Happy Sabbath.